like, and just to even take it back to that, like the physical example, right? Like we can see clearly that being physically healthy is important for leadership. You can lead and not be healthy, but there's going to be problems with that. And there's all different kinds of ways that we can mitigate being ill and leading. And so we can do that emotionally too. We can be emotionally unhealthy and still lead and still do an okay job. There's nothing saying you can't be ill and find supports for that and still lead. But if you can find emotional health, if you can get to that place, you lead in such a different way because you have so much more capacity.
Welcome to the It Matters podcast. I'm your host, Walter Perez, and let's dive in as we help you grow your mindset and elevate your leadership. Hey everybody, welcome back to the It Matters podcast. Thanks for joining me in another episode. I'm your host, Walter Perez, and this is the podcast where we talk about things that matter, and more specifically, things that are going to make you better as a leader. And today I have a special guest. Her name is Kim Sesink. And I've been looking forward to sitting down with her because I've had her husband, Kim Sesink, on the podcast before. Kim is a registered psychologist. She works in family therapy. She works in play therapy, in couples therapy, in faith-based therapy. She does it all, it seems like. And we have a great conversation about human behavior, people, leadership. I learned a lot from her, especially her perspective on how she approaches therapy and how it's important to help children and how that can affect us as adults, and how all of this is interconnected, and why when we work through things in life, how that can make us better leaders and how that can impact others in a greater way. And so we unpack a lot. I learned a lot, and I hope you can come for the ride and listen in and enjoy this conversation, because I do believe it's going to help you on your journey. And so if you enjoy this, if you learn something, can you comment? Can you share it? Can you pass it on to somebody that needs to hear this? And without further ado, let's jump into my conversation with Kim Sesink. All right, so welcome back to the It Matters podcast. And I'm excited that I get to sit down with Kim Sesink today, which, just a very quick fun fact, if anybody's been following the podcast, your husband was on the podcast last year, and we had an amazing conversation, not live in studio. It was over the computer. So you're the first one in the family to come into the studio and do this.
Awesome.
But welcome to the It Matters podcast. Thanks for joining me.
Thanks for having me, Walter.
Another fun fact that we should tell the audience is that you didn't have to travel far because we share an office.
Yes, just a couple of steps.
Right? Which is exciting because we chatted a little while ago, and we'll get into it a little bit more, but you were trying to get your practice set up and go on your own. And we had the opportunity to let you use our office and just collaborate that way. And so this is exciting.
Yes, it's been a fabulous transition for me.
I love it. I'm excited. Well, on that note, why don't you tell us a little bit more about yourself then?
Well, I was born and raised in Edmonton. So Edmonton is one of my favorite places to be, but more on the east side rather than the west side. So this is the last few years has been an experience moving over to the West End, and then finally deciding to move out on my own and work independently on the West End has been a fun adventure starting this year. So
that's pretty cool.
Yeah.
Wow. So you are married to Tim.
Yes.
And you guys, have you been working in your profession the whole time you've been married with him?
No. I started off as a teacher when we got married, taught for a little bit, and then decided to transition into therapy instead. And so took my master's degree while he kept on working, and then started in 2012. I graduated and been doing counseling since then.
That's pretty cool.
Yeah.
I have to ask, because I always wonder, has this always been the plan? Like since you were like a little girl, is this something that kind of happened later on in life that you're like, hey, I want to get into counseling, or kind of how did that evolve?
Well, it's funny. When I was a little kid, my mom used to listen to Focus on the Family.
Okay.
And so we used to, I would be in bed when Dr. Dobson would talk. And so there was something in me that was like, oh, being a psychologist would be an interesting profession. But by the time I reached grade 12, I had lost that idea somehow. So my mom expected us to go to university. So she signed me up to be a teacher because she's like, you like people, you like being with people. And so that's how I took that trajectory. We moved to Saskatchewan for a while when we first got married. So when we moved back to Alberta, it was difficult to get my teaching license transferred again. And so at that point, then I decided was the point when I could pursue something a little bit different. And that's when I took my degree in marriage and family therapy. So
wow.
Yeah.
No, I've heard, because I've had a couple of other friends on the podcast that are psychologists, and all of you are very different, and that's why I wanted to have this conversation. But I've heard that the exam can be challenging. Do you agree with that, or was it tough, or?
It definitely a challenging exam. It's the only exam that I've studied for months. Interesting fact, research into it has shown that passing it, not passing it, says nothing about how good you are at doing therapy. So one of the therapists here in Edmonton that I respect the most, she didn't pass it 3 times. And I would definitely say one of the best therapists in Edmonton.
Wow.
So just passing it doesn't necessarily mean anything, but it is hard to pass.
That's huge, right? Because you think about the importance that we put on passing exams like that, and that can play mind games, right? And so that makes you a registered psychologist in Alberta.
In Alberta,
right?
Yeah.
And so that's pretty cool. That's pretty neat. And we're going to chat a little bit more about kind of the different things that the services that you provide, because I'm really intrigued about some of the stuff that you do. But I am interested, though, in hearing from you, like, how do you define therapy? Because that's your thing. And so for anybody out there kind of going, I'm not too sure what that means.
So therapy for me is based on the personal values and worldview of the client coming in. So it's about me getting to know who you are, where you're coming from, what you need, and where you're hoping to be, so that I can help you get there. So a lot of active listening, noticing, wondering. It's a little bit different, I think, from what people would traditionally call Christian counseling, in that I'm not opening up my Bible and telling you what I think you need to do based on what God says, but listening to you, hearing what you feel is going on in your life. And if we're doing faith-based counseling, hearing what you feel God is leading you in and helping you get there. But definitely more of a following rather than a leading kind of perspective for me.
Interesting. Which makes me wonder too, and I'm wondering if you agree with this. It's because I'm in the coaching world, and you think about counseling and therapy. Would you agree that therapy helps? Like, one of your roles is to help people process better. Like, it's not just like, where in coaching it's like you're being the cheerleader, and potentially you are too, but like, I'm just guiding them to get through whatever their goals are. You are helping them process whatever it is that they came to you for, right?
Yeah. And so the processing part, I think, is trying to look for the integrating factors between like the thoughts, feelings, and actions that we're taking. What are the blocks in between those, rather than just saying this is the next action step, or take this thought, run with it. It's more saying, what is it about this thought that impacts this feeling or that behavior? And how do we then work with those aspects to find a different pathway, the preferred pathway? Gotcha.
Well, that's huge, because I'd love to hear your experience on this, but I think we live in a culture where not everybody has potentially gone to counseling or to therapy. And there may be reasons for that because they think that if I go ask for help, I'm going to come across like I'm weak, or, like or I'm good, I don't need help. So maybe to simplify this, do you believe, and maybe maybe I already know the answer to this, but that everybody should at some point in their life have some sort of therapy or counseling?
So maybe being a psychologist, the answer should be yes. I would say no.
Okay.
I don't think that everyone needs therapy.
Okay.
I think that there are really good reasons to attend therapy. Therapy is expensive, though. And so just even that as a barrier, the value per dollar might not be there for some people. That being said, I think there's very few instances where you get no value out of therapy. I think especially in our culture, in our day and age, it's hard to get a full hour of someone just listening to you, focused on helping you process the feelings and experiences you've had, aware of your lifespan, and then also not judging your experience. And so I think it can be a very helpful, valuable thing. But if there's a lot of resistance to therapy, there's a lot of different cultures coming together here in Canada right now, and including different age groups. And there's a lot of different beliefs about therapy.
Right.
So sometimes it's not helpful. And it's definitely a lot less helpful if you're feeling forced or required to participate in something that you don't see as valuable or helpful.
That's interesting. That's the word that came to my mind as you were saying it. Like, if you're being forced to it, it's not going to have the same type of impact. Right. And
no.
That's an interesting perspective too about the different cultures. It makes sense to me, but didn't really sit down and think about it and realize, like, wait, not everybody's going to have the same take on it or accept it in the same way. They might not feel that, hey, this is not what we need, right?
Well, like even just thinking generationally, right? My dad is old enough to be in the builder generation, just the tail end. But there's a very firm belief that therapy, counseling was for people who are really mentally ill. Right. There's also a very hierarchical way of looking at the world. And therapy with a young female therapist is not super helpful from that perspective, just because it's hard to take something from someone who's younger than you, female. So just even those pieces can be make it more difficult to get something helpful out of therapy. Right.
So I guess if somebody's listening out there, they should just kind of really assess where they're at and really ask themselves that question. If they're needing that extra help or their view on it. Because you're right. If you're going to pay for it, you really do want to go get something out of that. You don't want to just go sit there. And I mean, potentially just talking it out might be helpful, but yeah.
Well, I mean, in some ways, it's the difference between free coffee at home, $2 coffee at McDonald's, and $10 coffee at Starbucks, right? I think for the vast majority of us, free coffee at home works fine. If you're busy and you need some support in that coffee making process, McDonald's probably works just fine as well. And then there's some people who have worked themselves into the finer tastes of Starbucks coffee. And so then it feels worth it. But if free coffee at home is doing it for you right now, paying $10 for it feels insulting. And so really considering kind of where you're at, but there are things that make therapy really beneficial, right? So experiencing some of those traumatic experiences in childhood or mental health issues, it is helpful to have someone who understands what's going on and how to address it in a different way. So.
Well, okay. I'm glad you went there right now. You talked about, processing childhood trauma or different things like that. Before I kind of go there, one of the things that really intrigued me about your practice is that you do child therapy or play therapy. Can you explain to us what that is? Because that was, and before I let you go, the fact that we're sharing an office, I get to see all the toys that you have on the one end of the office in the studio here. And it's pretty neat. But so can you talk about that a bit?
Yeah. So I think that the number one thing is, well, are you just going to play with my kid? And the answer is yes. But I am playing with a different lens. And so we play with a lot of normal toys, right? Just little figures. We have sand. We do art. I even have just your typical games like chess and Connect Four. It's the way that I'm using them and the context that I'm using them in. And so just like as an adult, you sit and we have a conversation about what's important to you, and I follow your lead. In play therapy, we believe that play is the language of children. And especially when you're thinking about a 3, 4, 5-year-old, they're not going to sit down and talk about triangulation with their parents or parentification. They're going to want to play. And so using play, I try to explore those ideas, and kids bring them up themselves, right? You can see through play what they're experiencing. And as I see those, I then bring in my own playful ways of doing things to help shift what's going on in the play to bring in new possibilities. One obvious way that I often explain play therapy is in a car accident, right? A child may have been in a car accident, and sometimes they come in very literal and they just play out the car accident, crashing cars. And so we'll be crashing cars, I'll be crashing cars with them. But then I start to introduce, like, where are the helping figures? Who is there to help you? And just as an adult, we would talk about, I was so scared. We would talk back and forth. Yeah, you were so scared. And we'd go over what happened, maybe even a couple of times in therapy before I might say, well, who was there to help you? When did you finally feel like you weren't all alone? Wow. And I bring that in through play by bringing in maybe an ambulance, bringing in maybe a fireman, and asking questions with the fireman or those kinds of things to help the child then start to realize, oh, I wasn't always all alone, and now I'm not all alone. And so working through that process, but through play instead of conversation.
Wow. That's such a creative way. And I mean, what comes to mind is that children are different than adults. Though I will argue that even, I was about to say that adults will process different, and we probably have our own challenges, and we can probably learn how to process and how to get help in that area. But such a creative way to get children to interact, communicate, talk to you, right? Especially when they potentially might not even know how to tell you what they're feeling, right?
Well, and I mean, it seems obvious with kids that we're just going to use play because they don't have language. And as adults, we have language. But I think that there's a lot of subconscious processes that go on inside of us without our conscious thinking of them. And so play therapy actually is quite a bit of fun with couples and families as well. And I've actually even engaged in it myself as an individual adult. And to just see how sometimes what comes out in art or in a sand tray as an adult, all of a sudden I can see in a different way the situation, the problem.
I love that.
The solution even in such a different way, because I'm not just thinking concretely about it, but more expansively, more playfully too. So
the whole playful part, being creative, letting our imagination run, right? I can totally see how that could be beneficial. So I'm kind of curious too, because you already mentioned that an example for children play therapy would be like if they were in an accident. But what are like other scenarios where a child would need therapy? Because like maybe as an adult, and we can talk about it in a moment, but we can be like, well, I know this kind of passed or this happened to me, and we can kind of maybe work that out. But as a child, how would a parent maybe then identify that it would be wise to give them some counseling or therapy?
So most often it's identified through behaviors, because kids don't generally walk up to mom and dad and say, hey, I think I need counseling, because they've never even heard of it before. But generally it's behaviors that kind of get stuck. So we can't get past this no matter what discipline technique or encouragement we use. We're just not able to get past it. So I won't go to school. I'm not wanting to get out of bed. I'm being disrespectful. can't manage anger, and crying all the time. Those kinds of things tend to be the things that parents notice first, and bring them in for. Sometimes just even looking at the problem, even just as a parent, just saying, hey, notice this is going on. Especially if the child is older, you can even sometimes just talk those things through. But those are the behaviors that parents generally notice first. Obviously, kids are diagnosed with things too, right? So ADHD, and like oppositional defiance, all those kinds of things. When a parent gets a diagnosis, then they're motivated for therapy. Or, I mean, teachers also notice behaviors. And so
100%.
those tend to be behaviors tends to be the main piece.
See, that got me thinking because, and I've shared this with our podcast audience, and you know this, that we have a boy that has a rare disease, and he was diagnosed at 6 months, and there's a time in his life that we would call traumatic, right? And so we've thought about that, like, as we watch him, grow and develop and all that, like, how much of that has affected his life, and definitely a conversation to be had for sure, deeper, but that really kind of stuck out to me in acknowledging that, hey, he may want to talk some things out if he does remember or doesn't. I don't know, right?
And that reminds me of just a story from my own personal life, where a family member who had some severe disabilities had a lot of medical care as a child.
Right.
Even if you would wear a white sports coat near him, he would just totally dysregulate. And I think that seems very obvious to all of us. But it wasn't always obvious, right? To everybody that if the doctor is always wearing a white coat, which they've stopped wearing so much because they've started to realize that it imprints trauma on children, right?
Wow.
If every time a person with a white coat comes in, I get a needle or a painful medical procedure, white coats are going to be associated with fear. And so just even our medical professions have grown in, let's not wear the same color every day and associate this color with pain. And
you just never know how it's going to impact the child, because you just reminded me, for example, Armando, because of the hospital visits, he's had a lot of needles, and he's 8 now. And one of the things he does when he goes, he stares at the needle, like no fear. And I'm an adult and I'm okay with it, but I don't care to look at it. And so I remember thinking one time, and I'm like, well, from a parent perspective, he should have never got used to that. And I mean, that's part of our story, but it's interesting how it's affected him the other way, where he's like, oh yeah, that's all you got. Right.
Yeah. Well, and so something like that could be, about how do we gain control over things. So some people have to look at a needle when it's going in. Other people have to look away, finding what those strategies are and allowing people to use them to the best of their ability. The other thing that you mentioned that was interesting is that it can be quite traumatic for parents watching children go through painful experiences, because you feel helpless as well. And that's not to throw anything at you, but it's just an interesting thing to think about for yourself is how have I processed what my child is also processing?
I would 100% agree with you. And even in a marriage, to realize that as couples or individuals in the marriage, we process differently. That's been a big learning thing for me.
Yeah.
And I appreciate you saying that, because you're right. Just as much from a parent perspective, we got hit by that, and we need to make sure we're processing that.
Well, and coping strategies can conflict with one another. I think often in marriage, that's why stress and strain is such a good point to go into counseling, because the way I deal with stress and strain is very different than the way my husband does. I want to be at home. I want less things to do. I want everything to kind of be straight or tidy. Let's get everything under control. And he just wants to exit the city. And so those strategies can actually start to feel like we're pulling apart, because it feels like he's always running away. And I feel like I'm always chasing him down and dragging him back. And so to think about and have someone else even just help you navigate, I don't think they're doing this to hurt you. What other reasons might there be for this running away or this dragging you back kind of thing?
So that actually brings up an interesting question for you then, because I know you do couples therapy.
Mm-hmm.
Is it important, and at some point or before they do couples therapy, that the individual should work on themselves in some way? Like, is there something to be said about, depending on what the issue is, that we should be working on ourselves individually in some capacity,
Mm-hmm.
and then coming together into a couple setting? Or is that even a concern?
So there's lots of different ways of thinking about it. I was trained as a marriage and family therapist. So from that perspective, the idea is that actually, as I change and grow, I can aid your change and growth inside the family, right? And so we can actually be there experiencing some of these things together. Sometimes people need to process some things by themselves first. So one of the indicators against couple therapy would be ongoing physical violence in a relationship.
Right.
Not that physical violence immediately precludes couples counseling, but that if it's something that's used to control or to manage in the relationship, that needs to be dealt with first before the couples, because then couples counseling can kind of upset the apple cart in an unhealthy way. And so that's something that we assess for, is just kind of where is the couple at, and where might individual counseling be more effective.
Right. That's huge. I appreciate you saying that, because you're right. Scenarios can be a little bit different. And we also don't want to get caught up in this trap of like, I have to be put together and have arrived at some level before I can actually contribute to that marriage or that relationship, right? We don't want to buy into that lie.
No, because nobody actually arrives and is perfect at any point. And so really I do think that couples therapy is about journeying as two imperfect people on the same path together, providing what we can for each other, and just having someone to help guide that process and point out maybe some of those areas where we can change and grow.
Right. Yeah. The idea is to help you grow and get better, not just you. The whole idea about what I'm hearing anyway from counseling therapy, you're not going there to get beat up and feel like, you're the worst human being. No, it's meant to like grow and help and
and provide that safe place to talk about things that there really isn't necessarily space for in other places. So those topics that kind of are taboo in our culture, you can kind of talk about them in therapy in a different way, because as a psychologist sitting across from you, my job is to hear and to be with, rather than to say, oh, you shouldn't think that way, you shouldn't have felt that way, you shouldn't have done that, but more to ask you what your experience is of feeling that way, of having done that, and where you want to be now, where you want to be in the future, and then to map that out with you and walk that process, rather than to say, that's not where you should be right now.
That's so important, right? I mean, to be heard. I mean, all of us just want to be heard sometimes. And then out of that, we can at least make a game plan, or you can at least direct saying, well, you are saying that you want to go in this direction. So because of that, this is maybe the next step or whatever.
Yeah.
So, hey, I'm wondering, because we talked about, child therapy, we're talking about couples therapy, and so you have a nice scope of working with all ages. I'm wondering, and this is just because I've had a lot of conversations with different people, and I'm thinking, how do you connect childhood trauma to adult challenges? Like, in the sense of like, is there a connection? Like, is it very obvious that if we're having some challenges as an adult, that it'll probably be in some way connected to a childhood trauma, or am I kind of off on that?
So definitely there's differing perspectives again on this. My own personal perspective, kind of where I sit, is more in the present moment.
Okay.
So what's your perspective on it? I can notice links Do you think that this experience has anything to do with that experience back here because they look similar to me? Or I might notice, hey, every 5 years this thing happens. What do you think about that? I'm not saying every 5 years this happens, so this must be
right
where the root of the problem is. I want to explore that with people because I think that everybody experiences life experiences differently, right? All 5 people in a car accident come out of that car accident differently. One person may be able to just process it in the moment. They were able to make sense of it even as it was happening. And there's no trauma from that. They're like, car accidents happen. And there's, on the other end might be someone who's debilitated for years and never drives again. Right. And so how we experience and how we make meaning of the experience really puts us on a trajectory for health or unhealth, right? Or even having the opportunity to process it, right? Being able to sit down, have someone to talk to about something can really help us make sense of that. And maybe then we're able to just leave it behind us. But other people have never been able to talk about some of these experiences. And then often that makes it a lot more difficult to process because they're holding it all on their own.
Gotcha. I love that. Yeah, I love how you're bringing awareness to this idea that it doesn't have to be connected. Like, yeah, of course, there is some, if we haven't worked through it, we haven't processed. And I love that because potentially there's some of us out there that are using that, like we can think of an issue that happened when we were younger or whatever, and we might be using that as an excuse to not flourish today, which could potentially be true. But what I'm hearing you say as well is that it doesn't necessarily have to be that way, right?
Well, and the space that I really want to make sure that people get is that if I'm using this past trauma as an excuse not to flourish today, there's a reason for it. We have a good reason for doing the things we do today. Even if they make no sense to anybody else, they make sense emotionally to us. And so you may not be ready to, and not maybe, I'm saying you in general, not in particular, may not be ready to deal with that thing. And this is the way I'm coping with it. And yeah, it creates a lack of flourishing maybe in this aspect of my life, but that may be where you're at today. And maybe in 5 years, you've grown and developed in other areas and you're ready to look at this. I think also some of it is the guiding of the Holy Spirit too. He's gentle with us. If all of our faults were revealed to us in this moment, we'd all be really, really discouraged and have no hope to continue, which is why he deals with one thing at a time. And I think as a therapist, that's important, an important reminder to me that even if I think I can see something that needs to be dealt with, if you're not ready for it, you're not ready for it. Let's work with what you're ready for today and you'll get there. We all want to move towards flourishing if we can see it. So
I love that. And it's just kind of a reminder that that sometimes it works in layers, right? You got to deal with whatever this is first, and potentially it'll lead to other things that you might want to work in. And I know that in my own life, I've experienced that. And it's like, oh, I have a different mindset today because I've dealt with that. A quick example would be forgiveness, which I actually do have a story of that. And to not go into too many details, but there was a scenario where I didn't forgive for a good chunk of my adult life. And once I released that, whoa, and then I'm now working on potentially some small things, but I didn't even know they were there because I had this thing covering it up, right?
Yeah, and we all have those things. I think throughout our lifespan, there's different moments of like growth and change. When you're 16, 18, 20, you're moving, leaving home, you're really noticing all the things you don't like about mom, dad, the way things ran. I'm going to do things different. But I feel like as I moved through my 30s, I started to realize, oh, there's reasons they lived this way, they acted this way, they did these things.
Mm-hmm.
Maybe it wasn't so bad. It wasn't all bad. And I can let go of the negative and still hold on to the positive. And just thinking as I move through aging, that there's times for growth in different areas as well. And that if everything felt perfect at home at 18, we might just all live there till 35, or at least I would have. But realizing that my parents, most parents, do the best that they can with what they have. And that's a realization you get, I think, a little bit further away from living with them. Yeah. So,
a thought that came to my mind right now that I think we should point out, especially because some of the conversations I have about leadership and mindset, that I think what we're talking about is not just this transition of like, I have a negative thought and now I want to think about it in a positive light. There's something in there for sure, but it's not just an attitude change. And the word that we've been using quite a bit today is processing and working through. And so I wanted to bring that out because then we're not talking about this positive shift only, right? Like,
and it can kind of seem like sometimes, especially with some of the therapeutic models, like cognitive behavioral therapy, right? You get the little pieces and it's like, well, your thoughts affect your feelings, which affect your behaviors. Right. And it seems like a straight line. And so it can seem like you can just hard shift into, I can just tell myself, I'm going to be happy because life is good. And then I'll feel good. And then life will be good. And we can do that in some small things sometimes, I think. But it does have to be a complete mind shift where we actually move to a different place in the way that we're thinking, so that when we do notice the flower, we actually appreciate it. Gotcha. And then that actually grows into a feeling of like gratitude and appreciation, which then really does shift the way we believe, instead of just having like a little cue card that says, be happy about, like, smell the roses, right? And you're like, hey, smell the rose. Like, I can force it, but it's not as effective as getting to the place where I truly appreciate that rose.
100%, right? And we got to be honest about the season we're in. And you're right. Depending on what you're going through, if you had a loss, something traumatic happened in this season, you're not going to positive think your way out of that. And of course, we all react to it differently. Yeah. It'll affect us, impact us differently. And so there's a place for potentially being grateful, being positive. I 100% advocate for that. But let's also understand that we might have to do some of that work to be able to arrive at that positivity, right?
Yeah. And positivity can be a negative coping strategy too, that keeps us from actually recognizing what's going on for us, right? So we can just be fine all the time and not actually allow ourselves to grieve the losses that we're experiencing or face the sadness that's happening, the fear that we're experiencing. Those are important feelings too. They tell us about what's happening for us. And so we can't just use positivity to ignore what's happening for us. And yet I do think that there is the hard work of choosing gratitude. And so one thing that I've recommended to others that I've done myself in harder seasons of marriage is just taking, like one of those day timers with just like 3 lines in it, and every day writing down 3 things that I appreciate about my husband. Because often the things that we're missing are the things that irritate us the most, right? Like, why wasn't he home on time today? Recognizing, man, he's such a hard worker and doesn't want to leave before he feels like the job is done well. That's working hard to shift my perspective, not devaluing my experience of, I feel sad you're not here, but shifting the perspective onto the positive characteristic I can see, instead of just painting it negatively because of my sadness that I'm alone.
That's so good. And gratitude has a way of transforming us, right? If we ever put that into practice. I love how you're encouraging us to look at the benefits of that, because you're right. It can be life-changing, but I also really enjoy how giving ourselves permission to feel pain, giving us permission to say, I'm just not feeling well about this, and I have to, and I don't know. You potentially might not even know what you're supposed to do next, but coasting through life, acting like things are okay is not healthy.
No.
And so I appreciate, that makes me wonder, like, I was going to say, we have to give ourselves permission. And maybe in a counseling or therapy scenario, we might just need somebody else to say, hey, you're okay to feel that way, or it's okay to give yourself permission to do that, right?
Yeah, and I think that so often it's difficult to sit in sadness with someone else, and our culture just doesn't provide spaces or places to do that in the same way as maybe previous iterations of our culture may have done. And so we often have to apologize for feeling sad. I often talk with people who feel like, okay, I should be done with this grief. I should be over my childhood trauma. I need to move on, and to actually be allowed to slow down and have someone say, no, actually, of course, that's a big deal. Yeah. Of course, this is still hurting.
Right.
And let's sit here with that for a while. Is almost all that it needs to kind of come up and for real healing to take place, because we're not just running past it quickly, saying it should be done, but giving that space to say it's okay that it's not done yet.
So would you agree in this idea that, I mean, it takes time to heal sometimes, but you also have to be intentional about that time, like in the sense, like, it ain't gonna you're not gonna just arrive somewhere by accident. Like, yes, time is one of the parts of the equation, but you have to also be willing to put some intentional work into it.
Yeah, for sure. I think, like, when you think of any other process in human life, time is essential, right? You cannot grow and develop into adulthood without time.
Right.
But you can just be a 22-year-old child. It takes time to lose weight. It takes time to build physical proficiency in a sport. But time isn't the only thing needed, right? You have to have the other ingredients necessary. And it's the same with emotional health, right? Time is essential. We can't just snap our fingers and make it happen. But the other ingredients need to be there. And sometimes we have access to all of those ingredients just in our day-to-day life. And so I can get a little bit of this from my mom, and a little bit of that from my sister, and a little bit of this from my brother, maybe my husband, whatever, maybe my kids, right? Like, and so it might all be there. And so I might be moving towards emotional health because I have all these ingredients. And sometimes you come to therapy because the ingredients aren't there, or you don't even know what the ingredient is that you need. And then therapy, I think, becomes a place where we can help you find where those ingredients are in your own life, or to develop places to find those for yourself.
100%. I also feel the need right now to remind whoever's listening to this, because I like to talk a lot about leadership and all that, and maybe somebody out there is like, what does this have to do with leadership? But it has everything to do with that, because regardless of the role we may have, responsibility we may have in whatever arena we get to lead in, it will affect how we lead. If we're having potentially marriage problems or family problems, whatever it is, it will affect the way we treat other people potentially. Maybe even more important, or just as important, is how we treat ourselves, right? And how we love ourselves. And so to understand that this is part of leadership, and it should be part of taking care of ourselves and those we love.
Well, like, just to even take it back to that, like the physical example, right? Like, we can see clearly that being physically healthy is important for leadership. You can lead and not be healthy, but there's going to be problems with that. And there's all different kinds of ways that we can mitigate being ill and leading. And so we can do that emotionally too. We can be emotionally unhealthy and still lead and still do an okay job. There's nothing saying you can't be ill and find supports for that and still lead. But if you can find emotional health, if you can get to that place, you lead in such a different way because you have so much more capacity. When you run into those difficulties, it's not just another thing on top of the pile. It's just the thing in front of you.
Thank you for saying that, because I love how you said that you can lead but still be unhealthy in that scenario, which I'm a huge advocate of getting everybody to think about what it looks like to lead well. We can lead, but it doesn't mean you're leading well. And I think you just pointed to that direction of why it's important to be self-aware and to be working ourselves, because you might be leading, but if I can put it this way, you can be broken in that process, right? And you're not leading to the best of your ability.
And we're not, like, none of us is going to be in that perfect place throughout our entire lives. No. And so I totally believe in broken leaders and imperfect people leading. I think that the more time I spend, the more I'm able to find as much health as I can, the less it breaks you to lead. Because when I come up against those difficult moments, if I have greater health, I have more capacity to see this problem and to address it for what it is, instead of it bumping up against the broken parts of me and breaking parts off, right? Yeah. And so I can also then lead and recognize these are my weaknesses, these are my broken areas, and so I need someone to stand in this spot here, and I need someone to stand in that spot there, so that I don't break other people in my leadership. None of us is perfect, whole. But we can be better.
And you're right. There is no perfect leader, and if we're buying into that lie, then we need to adjust in that. But you're right. When we become self-aware in that, we realize, like, I don't have to be perfect. But in leadership, most of the time we're working in a team setting, and we have a group of people that are helping us, and we get to say, okay, I actually don't have the capacity to do that one role or work in that area. And it makes us even better in that, because now we're self-aware and we're going, I can ask for help, which I've said often, like, it's a sign of wisdom to ask for help, not a sign of weakness, right? And I truly believe that.
Yeah.
That's so good. Thanks for linking all that together, because I think somebody out there needs to hear that and realize, especially sometimes, and leadership has a big spectrum here, but there's certain types of styles of leadership where it can be very, like, controlling, overconfident, dominant, and those confident leaders sometimes don't realize that you don't need to have it all together. You don't need to be in full control to lead well.
Well, and I think often it's like our broken, our painful places that cause us to need to have that hyper control or that hyper dominance that sometimes comes out in leadership, because it feels safer to be in control. It feels safer to not let anyone challenge my authority. Because if that kind of challenge is going to break me, I have to protect that. But if I've recognized that brokenness in myself, something else take care of that, something else protect that, other than just dominance and control.
I've come to learn that I know there's different personalities out there, right? And there's, depending on the testing that you've done or the assessment, it will point out that there are certain types of people that are more controlling. But I've come to learn that everybody can struggle with control issues, if we want to call it. It just comes out differently. Yes. It looks differently, right?
Yeah.
And so I guess I'm saying that to say that we all probably struggle with it, and let's be aware of it and know that it's not just for some people.
Well, and that's what can be so helpful about using some of those learning tools, is to see, this is how my personality really wants to protect this piece of me. And that awareness then allows us to protect this piece of me, heal this piece of me, grow in this area, so that I'm not leading in a way that damages others, so that I can be safe. but still allows safety for me, because we're allowed to still be broken. We're still allowed to not be perfect. But if I'm aware, I can start seeing something's going wrong because I'm starting to do this more. I'm starting to see this piece of control come out of me.
Oh, I like that. I like the word safety that you use there, because you're right. It's not always just about what's going to make me most effective and, and rah, conquer the world. But hey, it allows me to realize some of the gaps that I have and realize that, no, this is safe. It's I can grow in here, but I can improve this area. And you end up realizing that you don't have to always perform in a certain way, right? That's so good. One of the other areas that you do work in is family therapy, which we kind of touched a little bit on. And I'm curious, because that has another dynamic. When we say family, we're talking about parents and kids involved. And, I could probably come up with one idea really quickly where you may want to take advantage of family therapy. But it's probably more complex than that. What are some scenarios where you would recommend family therapy to be something that you should pursue?
So unresolved conflict, whether that's we just can't get this to work in our family. So I see families with like young kids and parents in the room. Obviously, as a parent of small children, you can force them to do things. We can pick up a toddler and make them do things. But there's times when it just works better if we can all get on the same page.
Right.
And so whether that's just even ADHD issues. So I feel frustrated because I give them, like I just tell them to brush their teeth, put on their pajamas and get into bed, and they're still not brushing their teeth. Family therapy can be helpful in helping to navigate, how do we as a family address this issue? It's actually impacting all of us. And then as families age and grow, right? Conflicts arise and they don't necessarily get resolved. So just helping teens to be able to talk clearly and respectfully to their parents in a way that the parent can hear. Sometimes just that age gap can make it difficult for families to have those real, honest conversations in a way that honors everybody in the family, but still helps to preserve that power structure inside the family. And then adults, right? We often have things that we need to work things out with our parents, maybe with our siblings, and to have someone who's outside of the power dynamic structure that you're already in to help you navigate that can be really helpful as well. So not necessarily one specific, if this happens, then this indicates family therapy, but more, we're stuck. We can't get out of this. This happens all the time, over and over again. How do we do this? Or, one particular member in our family, we all focus on that. But recognizing that as a family, if I shift, if I grow, everyone else in the family has to shift too. And so we can all actually work together to help each other instead of just pointing the finger at the one black sheep in the family and saying, you're the problem, and sending them to therapy.
Yeah, right. Very interesting. I think that's something that, and I appreciate how you shared that, because you're right. It's not just as simple as like one or pointing out a few things, but the word that really popped into my mind too in this is that it improves communication, or it allows room for communication, which can be huge when you're dealing with a family or teams or groups or whatever, right? Communication is probably key.
Because we all get into patterns. And sometimes those patterns are healthy and help us grow. And so they work. Some of those patterns are less healthy. And as time progresses, they become less and less helpful. And so to have someone who can say, hey, wait, we're doing this again. Let's just slow it down a little bit. Let's focus in. You guys, when people show up in a therapy room, they want to connect. It's because they actually do love each other.
Right.
They just can't find the way to help each other feel that way. Right. And so I take it as my job to slow things down enough that you can really get to the heart of the matter, that I do really love you, and I act this way, I speak this way, I say these things because I'm reaching for you, and helping you to reach towards each other in a healthy way that actually provides connection instead of pain.
So another word that kind of comes to mind, and as you're speaking, is collaboration. You get to collaborate, especially that example about not focusing on the only one individual. I'm wondering, and not that I think you would have a hidden agenda when you're providing counseling, but are you specifically in a family therapy situation, are you trying to get people to be unified? Is that one of the outcomes, or is that just, or not even, you're just trying to work through things?
It really depends on who's coming in and what we're working on, and also what you mean by unified, right? A lot of times, uniform is what people mean by unified. So everyone thinks the same, does the same, is the same. That's pretty hard to get when you have more than one person in a room. But to be able to get onto the same page, yeah, for sure. We all need to be on the same page to communicate well and to work well together. Also, the ages of people really matters too, right? I'm not going to, it's not healthy for a 5-year-old child to have the same power as their 40-year-old dad.
Right.
But the 5-year-old still needs to be heard. And so I help to kind of create that balance between the two. So maybe sometimes bringing up a voice, making it louder, making it more obvious, calming down another voice. But my plan isn't to just throw everyone on the same playing field and say it's even and fair, because it's not. And we can see that between a 5 and a 40-year-old.
Yeah.
Sometimes that's the dynamic that's happening between that like 16, 17-year-old with their dad too.
Right.
And that's where those like big verbal sparring happens, right? Like I have thoughts, I have feelings. You have thoughts, you have feelings. I'm getting ready to like leave and live on my own. Maybe not quite ready yet.
Right.
And dad may be able to see that, but maybe that fear of you're not quite ready causes him to kind of clamp down and shut it down more than he really needs to, that there's that ability to kind of balance at least the conversation so that they can both be heard without removing all power structures and boundaries, right?
That makes sense. Wow. You have a very interesting job. I mean, like I'm not going to call it easy, because the dynamics of what you deal with, we've talked about a lot of things today. And there's one more thing I still want to talk about, because I want to hear your take on this. But yeah, everything from play therapy, dealing with children, couples, individuals, right? And then the family therapy, like, wow, that's pretty cool that you get to walk with people through that and just.
Well, and I think you understand that privilege, that to have people share their lives with you, and to be able to be a part of that journey with them is such a privilege. It's so enjoyable to be with people and with them on 100%. That journey. Yeah.
So you kind of touched on this throughout our conversation a little bit today, but this whole concept of faith-based therapy. And if somebody has been listening, maybe they cringed a little bit because we talked a little about spirituality, which is fine. We're not here to impose anything on anybody, but at the same time, this is something that's very real for you, and and it's in line with your values and what you believe in. But I would love to dissect that a little bit more. And what does faith-based therapy look like? Because how different is that than maybe going to your husband, who is a pastor, and having a conversation with him? Can you kind of walk us through that?
Yeah. So I guess the first thing I would say is, in a conversation like this, I see you at church. And so there's these pieces that like are just very real to me in my own personal life. And so when I mention Jesus or the Holy Spirit or God, it's because they're real and present to me at all times. So personally, they're integrated. In therapy, it's the client's decision. is this going to be integrated or not? So yeah, I'm not going to jump you. You might have cringed listening to this, but I'm not going to jump you in a session and tell you need Jesus.
Yeah.
My job as a psychologist is to start where you are at with your values and your worldview.
Yeah.
And I want you to then make the choices that work for you based on your worldview. I don't have to live your life and you don't have to live my life. And so I really want you to be comfortable with the choices you're making based on who you are,
right.
not based on who I am.
Right.
So when people do ask for faith-based counseling, I talk about kind of, I come from a faith perspective.
Yeah.
They may come from a similar faith perspective or a different one. And so it's important for them to really share what their faith perspective is. So when you're coming
right.
to me, my job isn't to give you my background theology degree and tell you where I'm coming from, but really to hear where you're coming from. So I'll often refer people back to their faith leader, whether that's like a Christian faith leader, or I integrate faith with like Hindus and Muslims as well, because where we ground our lives is where we find that growth and feel most grounded in the decisions we're making. And so I can bring in scripture, and I do sometimes with clients who share the same faith background as me,
right.
But I'm not going to tell you necessarily my interpretation or my theological perspective on divorce or
right.
on LGBTQ issues.
Yeah.
My goal is to take your perspective, if you're not sure of your perspective, to point you back to some of your faith leaders and say, well, what is their perspective? Because it's not going to be helpful for me to come and just mix my worldview into yours, get you to make a decision that makes me happy, and then you have to live with it. I don't want to do that. And so that makes it different than Christian counseling, right? Christian counseling often, if you're going to your pastor or if you're going to a Christian counselor, you've kind of agreed that you're going with their worldview, and they're going to tell you what is a smart, good idea based on scripture. If you come to me, you want faith-based counseling, I'm going to ask you how you think scripture informs or your other texts that you use inform the decision you are making. And we're going to work that through together rather than me telling you
and
what
then that
to do.
informs you to know how to then step forward. So that's an interesting thing. If somebody didn't realize it, because you have a counseling degree, and you just mentioned too that then you have a theology.
Well, I took like 1 year of Bible college.
Okay, that's okay. But, so you have experience, but then you're also married to somebody who's a pastor, and
yes.
But then outside of that, I mean, you just your faith is super important to you, and that's part of your core values and how you live your life. So that's pretty cool.
I mean, it can be problematic sometimes, right? Because I'm married to a pastor, so then people are going to assume that I have the same thoughts, feelings, and ideas as him, and I do sometimes, and other times I don't. But as a psychologist, the pillar of our ethics that I most often lean on is the dignity of the person. And I really, in therapy, ground myself on that first. First of all, because it really aligns with who I am as a person, that I really, it aligns with me as a person of faith as well, because I believe that Jesus gave dignity to all people. And so he has held no one hostage. So I'm not going to hold anyone hostage to my beliefs, as imperfect as they are, if he, as who I believe is the most perfect human, didn't do that to anybody. And so to really say, you're you in this moment, and you have to walk out this door as you. So we're going to try to come from your perspective and walk in the direction that you need to walk. You're the one who has to take the next step, not me. And so I'm not going to make you make the decision that maybe I would make or I would prefer, because you're unique. Yeah.
I love that. That's well said. I love that you can live out your faith and your convictions and what your principles and, your values that way. But for people to understand that you're still a registered psychologist, and you have a procedure that you follow right in the process, but but understanding who you are, who Kim is as a whole, is important too, because we got into this faith topic, and regardless of what some people may or may not feel about it, like I do believe that there's something important about taking care of your mind and your body and your soul, right? And if you're on a journey with that, that's great. Keep on the journey, but for those that maybe want to dive in a little deeper, that there is options out there where you can access this type of therapy, which is cool.
And I think that just like that reminder that none of us likes to be told what to do, or that our perspective isn't right, or to be honored for who we are as a person. And so if you're in, especially a therapeutic relationship that's just not working for you, right, that it's okay to say, I don't like this, I don't want that, and to actually be respected in that. That really, the reason that you're putting all this money out there is because you want you to grow, you want to grow and develop, and that it shouldn't be about the agenda of your therapist, that it's okay to find someone who fits better for you, and that it actually isn't okay to feel coerced in a therapeutic relationship.
And I love this. You came full circle, because we started this conversation too with also understanding where we're at, what season we're in, and it doesn't have to mean that the only way you're going to be able to feel good about yourself or get the help that you think you need is by going to a therapist. There's definitely huge benefits, and we're advocates for that. But also understand where you're at and allow that journey to kind of work itself out.
Yeah. And there's lots of people with lots of different ingredients, right? I can help with some ingredients, but there's a lot of other people that have those ingredients in different forms as well. And so, it's reaching out for that support. Yeah.
Reaching out and knowing that it is available if we're looking for it. That's so good. So, we're going to coming to the end here, but like, this has been so good. We could probably talk for hours. I always feel like it with all our guests, because it's like we could just go on, and with you specifically too.
Well, you have such fabulous questions. That's
well, thank you. I'm glad. Well, this has added so much value, and I think it'll get people to think, and hopefully maybe even have more questions, because I know that we're not giving everybody the answer or all the answers, but I just want to create that conversation and to say, let's have the conversation, right? This topic matters to me. And so on that note, through your life experience, I'm wondering, is there potentially a leadership advice that you've been given that has really kind of stuck out, that you want to share with us? And maybe it's a quote, or maybe it's something that you kind of think about.
It's funny, because earlier today my mom was here and she read the quote on your wall that says, if you can't change the cards you're dealt, change how you play your hand. And that's something that my mom always said to me was, some of us have, we all have different cards. Some of us have more cards. Some of us have less cards. And so to recognize that people are in so many different places and make so many different choices, they're not holding the same hand as you. And so to not judge it, right? If I have one last card to play, I'm going to play it different than if I have 42 cards sitting in my hand. And so just recognizing that we're all at different places. We all have different resources. And so not to judge where other people are at or how they're behaving, how they're playing those cards, because we don't always know. And sometimes we have more privilege than others. And it's easy to then assume and judge, but you may only have one card left, but you still have a card to play.
That's gold right there. That's gold. Just because you have one card doesn't mean you're necessarily at a disadvantage, or if you have lots in your hand, that doesn't mean that you're necessarily winning either. But I love that. And I appreciate the encouragement to not judge, which is huge. And I think we definitely need that in our culture, in our society today, to be remembered about that, to remind ourselves about that, because it's sometimes it seems like it could be easy to judge. So on that note, one of the things that I love to ask all my guests, because you are on the It Matters podcast, is what matters to you right now. And it could be anything, and it could be related to your profession or not. And so I'm just wondering, in the season you're in, what matters to you right now?
Probably the thing that matters most, or like my strongest priority right now, is family, just because we have small kids.
Yeah.
So, I mean, our oldest just turned 12, so we're moving into less small children, but our youngest is still almost 3. And so
Wow.
Just remembering that this is a short season, right? There's so many other wonderful things, in ministry, in my profession. But these are maybe 20 short years that I get with my kids. And so that's what I'm most passionate about right now, is just how do we do family well? Because it's a short season.
I love it.
Hopefully my career, ministry, they'll all be lifelong seasons, but kids at home, it's short. So passionate about that.
And children and family will definitely remind us of that. Hey, how short life can feel. And that's so cool. I love that. And I know you guys, I've got to know you in the last number of years, and you guys definitely prioritize family. And I know that that's important to you. And that's pretty neat. Thanks for sharing that.
Thank you, Walter.
So if we had somebody out there listening today that says, hey, I want to get in contact with Kim, I want to ask her some questions, how can our audience get to know you a bit more or get in touch with you?
So I have a website, Kimberly Sesink Psychology. You can search that up.
Yep.
I've just started a Facebook page.
Yep.
There's a few things on there. You can always just send me a message, ask me a question, and point you in the right direction if I'm not the right direction. And we can definitely start from there.
Yeah, we'll add that into the show notes so people have access to it. But on that note, if you have questions for Kim, if you want to, have questions about what we talked about, shoot it our way. And if it comes to me, I'll make sure it gets directed to Kim. And let's keep the conversation going, because this is an important topic. Kim, this has been an amazing opportunity. I appreciate you very much. Thank you for making time and just sharing your heart. And I know that you're passionate about this. And in this hour, we can't nearly touch on everything, which only means that you'll have to come back. But
I would love to, Walter.
We hope that this conversation added value and made you better today, in whatever arena you get to lead in. And like we always love to say around here, it is a win-win when the leader leads well. And so thanks for joining us. We'll catch you on the next episode. Bye for now.